So what we're going to do now, we're going to compare the organization of sympathetic and parasympathetic branches based on the neurotransmitters and their receptors. So first, let's draw the kind of general story here. So in sympathetic, I'm not going to do, I'm not going to do spinal cord, I'm not going to do brain stem, I'm not going to do sympathetic trunk, I'm only interested in two neurons. So you've got preganglionic, right? And you've got postganglionic. So pre, post. Organ. Are you following me here? In parasympathetic, you're going to have pre, you're going to have post, and you're going to have organ. Okay? So, let's talk neurotransmitters first. All preganglionic fibers of both branches release acetylcholine. Does that make sense? That's it. Postganglionic fibers of parasympathetic nervous system also release acetylcholine. Postganglionic fibers of sympathetic branch release norepinephrine. We're good? Okay. Now, as you remember from our previous conversations about neurotransmitters, these neurotransmitters have to interact with the receptors, right? Good? So it turns out that acetylcholine that's released from preganglionic fibers always binds the so-called nicotinic receptors. In other words, postganglionic fibers in both systems have nicotinic receptors for acetylcholine. And R is we're good? Make sense? Now what about what's on the organs? So in case of parasympathetic nervous system, the receptor for acetylcholine on the organ is called muscarinic receptor. Okay? We're good so far? What about norepinephrine? So for norepinephrine, the receptor here is going to be adrenergic. There are two types of adrenergic receptors, big types, alpha and beta. Okay, we're good so far in this part? All right? Clear? So, let me kind of trace what happens in sympathetic branch. So when stimulus goes through, preganglionic fiber releases acetylcholine. It binds to nicotinic receptor on postganglionic fiber. Postganglionic fiber releases norepinephrine, which binds to adrenergic receptor on the organ. We good? In parasympathetic branch, preganglionic fiber releases acetylcholine, which binds to nicotinic receptor on postganglionic. And postganglionic fiber also releases acetylcholine, which binds to muscarinic receptor. Okay? Good? Few things to make it clear. When you're going to be looking through the notes, in the description of sympathetic fibers, there will be some postganglionic fibers pictured that release dopamine, and actually some of them are releasing acetylcholine. We are disregarding them. Basically, I'm telling you, yes, there are exceptions, but I'm not going to ask about the exceptions. I'm going to ask about the rule. We're good? So if you know this, you're good to answer the questions on my exams. Is that clear? Another thing that you should be able to appreciate. So say I ask you, you want to specifically stimulate parasympathetic responses. Which receptor agonist? Remember agonist, the molecule that stimulates the receptor. Which receptor agonist you should use? So if you look at this, specifically parasympathetic, what your answer would be? Which receptor agonist you should use? Yes, for muscarinic receptor, right? Because if you use for nicotinic, you're going to kind of overall. And that's actually kind of a clinical example. If you would look at the, let's say somebody who didn't smoke, smoked several cigarettes in a row, the responses will be very, very similar to sympathetic activation. Why? Nicotine, as you can guess from the name, successfully binds the nicotinic receptor. It's a nicotinic receptor agonist. Are you following me? But sympathetic responses are more systemic, if you want to say stronger than parasympathetic. So you see that elevated bronchodilation, elevated blood pressure, increased heart rate, and so on, sweating, and so on and so forth. Okay, good? In the same manner, what if you want to trigger sympathetic responses? Well, you need adrenergic receptor agonist. You with me? Now, last little bit, I'm going to lay it out. We're not going to talk much about those drugs, but couple of things about generally. Term mimetic and lytic. So I'm going to start just kind of writing them down, and you will see the pattern. So if we say that the drug is sympathomimetic, so what does that mean? Sympathomimetic. It produces the effects that are basically characteristic for sympathetic branch. Okay, so that is equivalent to sympathetic activation. Are you following me? So essentially it's adrenergic receptor agonist. If you have a drug that is sympatholytic, it will inhibit sympathetic effects. As a matter of fact, you're familiar with beta blockers that control, what's the word? Blood pressure. They reduce cardiac output in patients with hypertension. So beta blockers, they block beta adrenergic receptors, and they are classic sympatholytic drugs. Does that make sense? In the same manner, parasympathomimetic will stimulate parasympathetic responses. I believe the drug is called bethanicol. It is used in patients who have issues with voiding, can pee. Bethanicol is used to help them to, void. Okay? And parasympatholytic essentially inhibits parasympathetic responses. A good example of kind of selective parasympatholytic is atropine. It very effectively inhibits muscarinic receptors. Okay? This layout, does it make sense? So I can ask you a question, something like, if you want to we didn't talk about this, but let's put it this way. When you have, so parasympathetic is rest and digest, right? I just want to give an example. Rest and digest means that definitely your digestive system is going to be stimulated. You following me? So I can ask you a question. What should you use to specifically increase digestive activity? What kind of drug? Okay? Specific increase digestive activity. And you look at this and say, okay, increase digestive activity. So I need something that would mimic parasympathetic signal. I need parasympathomimetic. Does that make sense? Can there be the words muscarinic receptor agonist? Sure. But you get the gist. I'm telling you, laying this on a piece of paper before you start answering questions is super helpful. Okay? Brain dump is invaluable here. Questions about this layout? Oh, one thing that I forgot to say. Again, I don't have a chance to talk about it much here, but here's the thing. Sympathetic system causes a variety of responses, as we will learn in our next video. But the point is, norepinephrine here, for instance, will stimulate your heart, okay? But will inhibit the motility of your digestive system. Are you following? So it is stimulatory for one organ and inhibitory for another. Why? What's the mechanism? Turns out that alpha and beta adrenergic receptors, there are even subtypes within them. I believe there are 3 different alpha adrenergic and 2 beta adrenergic. No questions like that on the exam. The point is, you have a variety of receptors that all have different responses to norepinephrine. And what determines how a particular organ will respond is the ratio of those receptors. Does that make sense? You have more beta 1, it will be activated. it has more alpha 2, it will be inhibited or whatever. I never remember what they do. Okay? So it's a ratio of receptors, not just the receptor, ratio of receptors. Good? This actually kind of adds a little bit to the point that parasympathetic is much more precise, like yes, no, response, no response. Sympathetic is super broad. Okay? Good?